Hey guys, it's Dave. Today we're going to talk about a condition that is, granted, strange, but it is actually more common than you would think. And in my time as a pharmacist, I've actually seen one case of it. It's called hairy tongue or furry tongue, or it can even be called black tongue. What happens is the tongue itself turns dark brown or black. The nodules on the tongue become bigger and look like hair, and they're dark like a dark head of hair. They can actually stand up to about 18 millimeters, which isn't that tall. However, if it's your tongue, it's very uncomfortable. It generally starts out with some stinging or burning sensation in the tongue, kind of like when you drink hot coffee or tea and you burn your tongue. The pain can then go to the roof of the mouth and under the tongue as well. It occurs when the papilla don't shed properly, and there's a buildup of the skin protein keratin. Food, yeast, bacteria, chewing tobacco, coffee, all hide in that. And so the overgrowth just continues to build up, kind of like rust does on steel, and it's not a good thing. Your risk actually increases with age, and smokers, chewers, and people who drink a lot of alcohol are at greater risk. It does occur in 13% of the population, which, like I said, that's a higher number than I would have thought. Risk factors include poor oral hygiene. You need to remember to brush your teeth, especially more than once a day. Flossing is a good idea, and visiting your dentist on a regular basis. Again, a good thing. Tobacco use. Coffee and tea drinkers, like I said, are at higher risk. Alcohol drinkers are at higher risk. People that have non-abrasive diets are eating a soft, bland diet. And what happens there is you're not getting the abrasion to work off that skin off the tongue that you normally would get. So you need to make sure you're eating a balanced meal with a lot of different textures as well. The other thing is dehydration. If you're not getting enough fluids, mainly water, you're putting yourself at risk for all kinds of things like dry mouth, cavities, and furry tongue. If you're going through chemo, radiation, you're at a higher risk. Mouth rinses, including Paradex or chlorhexidine, that contain peroxide. If you use those for an extended amount of time, it changes the microbiome in your mouth. So it's not a good idea. Certain antibiotics like tetracycline, penicillin, Zyvox, erythromycin, those can all make you more prone to it, as well as Prevacid. That's mainly the only proton pump inhibitor, or lansoprazole, the generic, or Pepto-Bismol. Those all can make you more prone to it. Sometimes you will just get it and the cause is unknown. That happens as well. Symptoms, like I said, are generally cosmetic. You're kind of freaking out. You wake up in the morning and your tongue's all black or brown and you got fur on it. Generally, that is the main problem. It's cosmetic. However, because of the fact that you're going to have poor oral hygiene, you're going to be more prone to infection and thrush. Also, as you're wearing that off through brushing, going to the dentist and having them work on it, or changing your diet up and it will come off naturally, it can be painful. And there will be some stinging and tingling associated with it. Like I said, you may see a change in your breath. You will develop bad breath, and a metallic taste will occur with a lot of the foods that you eat that normally wouldn't have that. Those are the main things you'll look at. The good news is it is a transient condition, meaning it's not going to be there forever if you change the way that you eat and take care of your mouth. So if you get back to eating a good, healthy, mixed diet, you cut back on your smoking or chewing, stopping is best, you cut back on your alcohol, tea, or coffee intake, and you go to visit your dentist at least once a year. And make sure you're drinking a lot of fluids, especially water. Because again, if you're dehydrated, it puts you at greater risk for bad things going on in your mouth, such as cavities, bad breath, gingivitis, and furry tongue. And just to top it all off, I wanted to actually give you guys a picture of what we're looking at here.